Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
The psychiatric mental health nurse practitioner is evaluating a patient with significant anxiety and depressive symptoms. In the course of the evaluation, the nurse practitioner further appreciates that the patient is having hypnopompic hallucinations and that the patient is very concerned about this because his uncle has schizophrenia. The psychiatric mental health nurse practitioner advises the patient that A. There are a variety of pharmacologic options that can be helpful. B. The hallucinations are benign and not a cause for concern. C. There is no need for intervention unless they are accompanied by sleep paralysis. Or D. The sensory systems involved will dictate the need for further evaluation and treatment. And so, interesting question. I I was going to say it's unlikely that the patient made an appointment and said, "I'm having hypnopompic hallucinations." Although now with Dr. Google and all the other forms of artificial intelligence out there, it is of course very possible that patients are researching their symptoms and coming up with these terms. However, if the patient did research and learn that he was having hypnopompic hallucinations, then he probably would have realized that B is the correct answer. The hallucinations are benign and not a cause for concern. Hypnopompic hallucinations are hallucinations that sometimes occur as the patient is awakening from sleep, transitioning between sleep and wakefulness. That's what a hypnopompic hallucination is. The corollary are hypnagogic hallucinations that are the same type of extremely vivid hallucination can occur when the patient is transitioning from wake to the sleep state. And while they can be very vivid and very concerning to the patient, they are generally considered harmless. If you've probably had them, everybody listening has probably experienced this at one point. I mean, there are a variety of theories about where they come from, and the one that I keep reading about is the theory that the patient is REM sleep deprived. In other words, you've had, a day or two or three of really, really poor or interrupted sleep. And so your brain, rather than descending appropriately through the stages of non-REM sleep to prepare you for REM sleep, you sort of drop off into REM sleep very quickly without your brain preparing for it adequately. And REM sleep is, of course, the stage of dreaming. And so that does make some sense from the hypnagogic perspective. I don't know how that would apply to when you are waking up, because if you woke up, presumably you were just sleeping. In any event, the real important point for you all that are preparing for your boards is A, to know what they are. Just by definition, what is a hypnopompic hallucination and what is a hypnagogic hallucination, and to know that in their own right they are considered benign. They are not considered a hallucination in the sense of a psychotic hallucination that a patient may have with a schizophreniform disorder or any other, drug-induced psychosis or whatever. The fact that they distinctly represent a transitional state between sleep and wake is what makes them hypnagogic, hypnopompic, and non-concerning. Now, in our question, the patient has a relative that is schizophrenic, and of course, I guess it's scary. That's why they come to see you as the professional. But if the only hallucinations they are having are in the sleep-wake transition, that in itself is not a cause for concern. And so B is the correct answer. A is not correct. Pharmacotherapy is not indicated. There's no reason to medicate this type of hallucination. C is not correct. Sometimes these hallucinations are accompanied by sleep paralysis, which again can be very scary for the patient, but they don't imply any ominous underpinning. Again, more likely it's a sleep deficit where the patient is moving through the various non-REM and REM stages too quickly. And D is not correct. These hallucinations can be extremely vivid and involve any of the senses. They are often described as, quote, more realistic than typical dreams. People will talk about how vivid the colors are, or that they could actually feel the touch of something, they could smell something. There can be multiple sensory stimulation with these types of dreams, but again, by themselves, they are not particularly a cause for concern. A sleep study might be appropriate if the patient is having them repeatedly and you go through steps of sleep hygiene and things like that. I had one patient who used to have very interesting hallucinations, and they were the from sleep to wake variety, like the hypnopompic hallucinations we're talking about here. And she would have some very vivid dreams that almost sounded like ketamine therapy with bright colors and like big fish swimming in her wall and just sort of really vivid, kind of almost cool stuff. But then she developed a hypnopompic hallucination that was repetitive, and it was the sense of having a bowel movement. She was waking up genuinely feeling like she was having a bowel movement as she woke, and she was not. And she went for a sleep study, and I wish I could remember exactly what it was, what the terminology was, or what they attributed it to, but it was ultimately a hallucination, a distorted perception of the senses. So in any event, again, I digress. What's important for you from this question is, like I said, hypnopompic hallucinations are those that occur as you transition from sleep to the wake state. Hypnagogic hallucinations are those hallucinations that can occur as you transition from wakefulness to sleep. They can be exceedingly vivid. They can involve multiple senses. And in their own right, they are not concerning or harmful.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.